Hello everyone, happy Friday. So I'm just gonna jump right in. Okay, so from chapter 19, I learned that a thyroid storm is associated with hyperthyroidism. And hyperthyroidism is when the body produces excessive thyroid hormone, which can cause the body's metabolism to speed up, and this can cause unwanted weight loss, tachycardia, heat intolerance, severe anxiety, muscle fatigue, and exophthalmos. When a thyroid storm occurs, the hyperthyroidism is induced even more. The thyroid hormone becomes out of control, which causes excessive sweating, fever, which can only be controlled with a lukewarm bath and aspirin. But aspirin should be avoided when they are taking any hydrocortisone or beta blocker. In a thyroid storm, the patient may lead to heart failure or a cardiovascular collapse, and that is when the beta blockers should be given for prevention. Another treatment given to help a thyroid storm from occurring are sodium iodide and propylthiouracil, atropine, which is an anticholinergic agent. Epinephrine and iodine should be avoided to prevent inducing hyperthyroidism and a thyroid storm from occurring. And then from chapter 16, I learned that steroid supplementation is usually used when a patient has severe dental anxiety or when the patient has a surgery that can put them at risk of an infection or inflammation due to the adrenal insufficiency. If a patient has an adrenal insufficiency, such as Addison's disease, which they are already taking a daily dose of steroids, they may need a steroid supplement. But first, it is our dental duty to help determine if they will need a steroid supplementation because steroids already tend to suppress the body's immune system. And depending on the type of treatment the patient is receiving, it can either put them at negligible, minor, moderate, or major risk of developing an infection or delay healing time. So depending on the risk and what type of procedure the patient is receiving will determine the dose and duration. For example, a hydrocortisone or prednisone will be used the day of surgery, and depending on the risk or the type of surgery will determine if it is a 5, 10, 25 milligram, etc. Moving on, from chapter 18, the common medications to treat diabetes are insulin, which can be produced from an rDNA synthesis, and the use of pig insulin, which I never knew this until now. Then there are various combinations of anti-diabetic agents that are used to treat type 2 diabetes. I actually had a patient yesterday who stated he was a pre-diabetic but took metformin and glipizide to help lower the blood glucose levels. And some of the medications used to treat diabetes can cause the patient to have altered tastes, erexostomia, and or hyposalivation. So this then puts the patient more at risk of dental caries, periodontal disease, oral infections, and delayed healing. Last but not least, in chapter 22, I learned that all pregnant women should avoid teratogenic drugs because this means it can have a harmful effect on the fetus. Common drugs that are known to be teratogenic include aspirin, NSAIDs, opioids, tetracyclines, warfarin, phenytoin, and lithium. Aspirin and NSAIDs can be harmful by causing birth defects, prolonged gestation, or even stillbirths. Opioids involve the fetal abnormalities such as heart defects, respiratory problems, GI disorders, and cleft lip and palate deformations. Lastly, in the dental office, it is best to avoid large doses of local anesthetic and avoid bupivacaine because it is reported to be teratogenic as well. Either stick to lidocaine or prilocaine. And most importantly, drugs should altogether be avoided unless the drug outweighs the risk of the fetus and there is a for sure indications that they're safely to take. All right, thank you.